Hello, everybody, and greetings from Georgia, Batumi. It's a great honor to face Ukrainian doctors, and grateful for Marina Nikolaevna who invited me to report my little case. Maybe it will be interesting for you. For the beginning, I wish to the Ukrainian people win and peace, and I will show it will be. So let's begin. I have a little case report here. So it is this case is recent. This male was discharged from our hospital a few days ago. So the history is like this. This patient came on consultation 1 year ago, 55 years old male. He had a risk factors, hypercholesterolemia, smoker, 40 years, hypertension, maximum blood pressure 117, and genetics. Father died at a young age with MI. So total cholesterol was 5.9 and LDL was 3.4. So we calculated risk factors, and let's see what we got here. This is the score 2 from ISCardio, and we see the patient 55 years, total cholesterol, and we can manage that he appears in high-risk patients to develop cardiac CVD, right? So hypertension, let's repeat: hypertension, hypercholesterolemia, and genetics. We gave him a treatment and recommendations. You can see the treatment: and Nebilet, and recommendations have a healthy lifestyle, to quit smoking, and we recommend him to lower his LDL below than 1.8. That is the recommended the high risk patients, right? So this patient wasn't so disciplined with his health. He never patient did not receive medications regularly. He never reached the level LDL below than 1.8 millimole per liter, and patient's visit wasn't permanent. So a patient didn't receive regular medications, and visit in 1 year he visited only 2 times, and we never reached our goals, not in blood pressure, not in the LDL level, and not in any goals we just wanted to reach. So in a few weeks, 1 week or 10 days ago, he was changed in our hospital with again radiating to the left, fasting for 3 hours. There was ST segment elevations on the ECG. You can see this ECG here. On second, third, and AVF leads, blood pressure below than 100, heart rate 16, and before we started, we approached offshore to do acute choreography, and before we started this procedure, he developed ventricular fibrillation. So we did defibrillation, 200 joules, and restored heart with sinus rhythm, and we begin to do coronarography. So here you can see the angiography. Here's the left coronary artery, and it is diffuse disease. You can see in the LAD and circumflex there is the severe. Also with right artery artery occluded, and we opened right coronary artery, put two stents in this vessel, culprit lesson, and after this, yes, two drug-eluted stents, we put it in the right coronary artery, and then you see we have a nice angiographic result here. So in the acute phase, we treated patients. We gave him 300 milligrams aspirin perol, 60 milligram, and intravenous heparin. And we got finally nice angiographic results. Offshore we planned another interventions in LAD and circumflex, but for now we just finished our procedure. Pain after PCI, pain relieved immediately. Blood pressure normalized, 110/70 millimeters hydrogen. Heart rate 60, and patient stabilized. And after PCI, troponin level was very high. You can see 13. But the intervention was very quickly. We did it in 14 minutes, everything. You can see the ECG after PCI. ECG also we have the ST segment. We have not ST segment elevations anymore here, and we have subacute ECG signs here, and nice sinus treatments. Also, I can show you the echo after PCI, and it looks like perfect. Even can't say that this man have ever a myocardial infarction or something like that. I have been telling you the result is very good. But yes, so treatment after discharge. You can see those medications: Nebilet, Prostarium, Norvasc, Liprimar, 40 milligrams, aspirin cardio, Sugrel, 10 milligrams, and recommendations. We had recommended before we knew patients' vessels LDL level below than 1.8. Now, when we know patient's level and he got PCI, he automatically appears in very high risk patients. So our level, LDL level, should be less than 1.4 or 55 milligram per deciliter. Smoking cessation, blood pressure control, and we also planned coronary intervention in LAD and circumflex. So this is the end. Don't joke with your heart. It doesn't have a sense of humor. That's what I told to this patient. He was very excited about fishing, and all the time he was talking about the fishing when I was doing this procedure. Even after the atrial ventricular fibrillation, he was telling me about some fishing stories. So that's what I tell this patient. Thank you for your attention, and the continue of this story. Maybe I can tell about 2 or 3 months ago, if he appears and if he will do those recommendations I gave to this patient.